Hello viewers, and welcome to another episode of Ellen Keister, the Real Talk Show with me, your beautiful host Ellen Keister. In this episode, our guest is an OBGYN with over 15 years of experience in the medical field. She's a dedicated advocate for women's and girls' sexual and reproductive health. As owner of the Women's Place Medical Center, she has been providing a beacon of hope, support, and safety to countless women yearning for trustworthy and optimal women's health services in Sierra Leone. Who is she? Find out right after this break.
Let's watch the Real Talk with Ellen TV show. By our very own daughter of Sierra Leone, Ellen Keister.
Welcome back to Ellen Keister, the Real Talk Show. Today we're going to talk about human and of course we talk about sexual and reproductive health. With me, I get the owner of the Women's Place, we're named Dr. Frances Ramatu Wurie. Welcome.
Thank you so much. I'm happy to be here.
Thank you so much. First of all, I follow all your videos on TikTok, and I think so which you do really good because a lot is happening in Sierra Leone, especially when it comes to women and health. And I saw the video. That was one of the reasons I was like, I have to reach out to her so we can talk about so many things. Of course, you know OBGYN of 15 years experience. However, sometimes you sit down, you know what it mean. So let us come. So OBGYN, what does that mean?
Okay, so I think so. We are one of the fields of medicine we get double title.
Okay.
The obstetrician part now like woman where the doctor where they take care of woman we get belly from the time where you get the belly till you born. The gynecologist part now doctor where they take care of woman any kind of woman sick from basically where you small till you right through your productive lifespan, till you reach to menopause, where I hope so we'll talk about later.
Oh, yes.
So like any woman, then a gynecologist. So basically, let's just say a woman doctor, if you want to say that way. It's the easiest way than if
Yeah, definitely. Better way I make it clear for not saying like a woman doctor, because in the beginning I tell you something about the woman then. So it don't tell you how you end up now at this field, because some people they do it because of the money, some not the passion. But with you, Frances, when you decide to want to be OBGYN?
Well, where I be in medical school, I be no say I'm interested in surgical aspects of medicine. You know, like where we do fourth year, they do general surgery. We'll go fifth year, they do gynae. I be no say get for do with surgery, but obviously personal experiences. Initially, I be one for be like a general surgeon. They do appendix and hernias and all of those things, but I lost a child, so with that experience I just figure like say all of those emotions we maybe they go through on a personal basis. I can imagine somebody in that state we're not pregnant looking forward to a child and then it worked that way. So my mind, with the help of two of my colleagues, really just switched to obstetrics at a later stage, because really I was going to be a general surgeon. Yes.
Okay. So when you say you lost a child, of course, I unfortunately I went through the same thing as well. But your part, was it through, surgery or, I mean?
So yeah, my delivery was a cesarean section, but that was not the issue. The issue not be just the babies, it was a twin pregnancy, they were premature. Okay. So yeah, they were premature.
Okay, cool. So you're the owner of the Women's Place. Actually, funny enough, until today, and I realized that you're the owner. I thought you were just really just working and everything else. So I'm okay. Go girl.
Yeah.
So now that make you decide for get your own clinic, because other people come and just support the government, meaning they do their own thing, but you're private.
And that's exactly what I did, because where I studied in Uganda, so there I do me obstetrics specialization. So where I come back, they work in government for sure. But on a daily basis, as you go through your work schedule, you realize that there are so many gaps. And you on your own not able to fix a whole lot of things. It's always a concerted effort. And sometimes I think, when we get frustrated as healthcare workers, it's like, what else can I do? Right. I mean, it got to a point where under my desk I get sutures and gloves for in case person not able to afford. And I'm like, how long can I do this? It's not sustainable. And I realized that there were so many patients where want that kind of personalized care where maybe in a government hospital I couldn't provide. So that is one of the reasons why I say, okay, let me branch out and get a space so I person able for come say I don't have to give you a prescription to go and buy gloves. I don't have to give you a prescription for like basic things.
Right.
Maybe they disturb me as a healthcare worker, let alone the patients who could afford it sometimes. So yeah, so that was one of the reasons, just for like be like say a place day. Also, a person they feel comfortable for working,
and everything is there.
And everything is there that you need.
Cool. So what do you offer there? Because I mean, do you do everything like what you talking earlier? Like it has to do with women. So everything woman they go through. Do you do everything there?
Yeah. So like I mentioned, right through the lifespan. So let's say we start with adolescents. I don't get a lot of parents them when them picking them starts for see-them period. They bring those girls in so that we have that first conversation about your body hygiene, sex. We have that conversation in the clinic. That's adolescents. We go through Ura try for get belle in terms of infertility. Ura don't get the belle in terms of antenatal clinic. We're person ready for born. Obviously, we have delivery services. So that's the obstetric part of it. Then we come to the gynecology. From you simple infection that you may have, you cervical cancer screening, you STI screening, you breast exams where you're supposed to do all of those things we discussed. So surgical services for whatever different surgical aspects you may need as well. So it cuts across. So that now we don't do since we opened in 2021. And then this year we decided to add a pediatric component to it because quite clearly, if you are dealing with expectant mothers,
you need care, you need
for follow through and make sure say somebody did it, we're able to watch them babies there throughout as well, and not only babies up to under 5s. So we don't also include a pediatric component to our services.
All right, that's great. I think that's important because, like you say, go just release the patients and then no side indicating picking and go and everything else.
Right.
Let's say price briefly before we go to the most important thing that we're going to talk about. Are you really expensive? Because that's the issue as well. When I say private clinic, I'm afraid like, I not about further.
Well, for sure. I mean, I have to be honest. For you able to provide the services where you provide, it involves cost. Obviously, with government facilities, you need to pay a consultation fee, but you definitely pay for almost everything because sometimes things are stuck out. So compared to what would I be answering that question compared to other private facilities or compared to like Posiwango Bona Ghana or Nigeria?
I mean, definitely you go cheaper than go Bona Ghana.
Certainly, if you're going elsewhere, it's going to be less expensive, but I think it's at par with most of the other private facilities.
Clinics, and it's something at least it's affordable.
Yeah, people can afford it.
Not just
people
like
don't show up. Yes.
Cool. So, reproductive rights of women. Of course, you're not advocates. What do you go saying are some of the challenges that women they face, especially in Sierra Leone? Because, like you were saying, we mentioned something about sex earlier. A lot of things we don't talk about. What are some of your challenges?
You basically they say in this country or in most African or conservative environments, certain things that we no one talk, but we consider taboo.
Right.
We know. It's almost as if people feel like if you are talking to a 16, 17-year-old about sex, now you they encourage them to get sex. When in all honesty, what you're trying to do is ensure that they get the right information so that if they do choose to engage in sexual activities, they know waiting at the right, waiting at the wrong, how for protect themselves, how for make sure say they're okay. Which is really the essence of advocacy where camp adolescents sexual and reproductive rights. Where camp contraception, for example, family planning. Also, all women are able to just say, well, me, I go take family planning. You get for go talk to your man, you get for see okay, when I get for agree before you come. But some of these things incur costs as well. So that challenges where camp like if you might afford them for himself or if he need help. For able to get so contraception, adolescent health, for example, even the right to say this number of picking our born. So all are able to say born. I mean, I've had issues where I've had discussions with couples where maybe the woman they get in number 4 or 5 cesarean section and the man say no, it go still born back. And I'm thinking, wait, you have to consider her health. You have to consider her life, like all of the intended. So there are challenges because not to all women so independent in decision making, even with health things, then we involve her body, her life.
Right.
Yeah.
Yeah, I think that's what it is as well, because like you say, they don't really look at the health part of it. Like we say cesarean. Imagine how many times you could go for go and cut
But even if not normal bone safe, I mean, I don't get people that would go 7, 8, and there are so many risks. The more pregnancies you have, the more babies you've delivered, that's what the risk just they increase. So the fact that some women are also not getting access to the information. Let's have that clear. Because some people don't even know, what are my options? What can I do? And then the one day we know now get all the limitations we camper all with social constructs the way we get in the country.
I know, and that's really crazy, and I'm happy that you guys are really pushing all of these things out, because I remember growing up, we actually been gets like FLE, for example, would not be would not be subject, and then just pull all down this. So nobody really knows a lot of what's going on. I don't get even a sexual therapist we come as well, where can always say, even the beginner, for example, all parents are beautiful tell we if man should get belly versus really going into details. Exactly. This is some of the things. So it's a lot is really going on, and we're gonna talk, boku, especially like menopause. That was like the video I saw, and yeah, I need to learn a lot too. A lot is happening for me here. Wait, don't go anywhere, because I'll be right back after this commercial break.
Small businesses are not small. They keep you pumped. They keep you learning. They keep you healthy. They keep you stylish. They keep you fed. Happy birthday to you. They keep you smiling. We can do all of this because they keep us moving. At UBA, we keep your small business moving because your business is big business. Ready to get moving?
Welcome back to Ellen Keister, the World Talk Show. If you just walked in, I have Dr. Francis Wurie. We're now the owner of the Women's Place Medical Center. Of course, he didn't answer with me, and today we're going to talk about women and health and menopause and so many different things that we all know, because I'm not going to say we know something. You said no, but today answer for let we all learn. Welcome back, Dr.
Thank
Wurie.
you so much.
Welcome. Of course, before we go on the break, like you say, we don't talk about some of the things that are taboo.
Right.
Like you said, it's not even a Sierra Leone thing, it's just African parents. And it's so funny when I mention, say, them, they tell we, say, we touch a man, you go get belly, you were like, you were told the same thing. It's, look at the parents, how they communicate.
Yes, then we get the same list for go through the checklist. Yeah.
Right, but I think, say, waiting we need for Dunana for just really open up. And I think I need to do even with your center as well. Because we talk about adolescent health.
Yes, so as I mentioned, I know I don't get a lot of parents say where they come to me and say, oh, my picking just begin same period, or I think say my picking not begin get feelings or what's not, so they are big and able. You talk to her. Okay. So then I say, okay, how about we get a group of these. Initially it was young girls. We don't do that until like 3 times. Okay. Where we get maybe 20, 30 young girls come at the hospital. And then we just talk to them about hygiene, puberty, sexual health, sexual and gender-based violence, because there are so many things then we culturally we accept, with a girl picking go can sit on her uncle lap, or girl picking go they pass then knacking ways, hey they big go, all of those things where you're supposed to say, that is not supposed to be done, right? So like we do that only 3 times with girls, and then somebody say, well, if you they talk about girls, you also for mention the boys. Also for make sure them boys there, so assess get the space for not only feel safe and communicate about the changes where they happen within their body, but also ask questions, because now it difference maybe when we grow up where internet's not there and all the rest of it. Now it's my paddy tell you. But now they can just go and Google. I mean, my oldest son is 11. He able go and do everything on the phone. So 2 weeks ago, we bring about, 23 boys.
Wow.
At the center, we get a session with them for about 2 hours. We get 2 male doctors. We lead the session. I took a back seat. We lead the session, but it was so amazing because then we get so many questions. But they knew so much. Like, we, when then I asked my mom and papa, then you feel like, I'm picking quiet. No. They knew so much. So that was also very, very good. So we intend for to continue for today.
All right, how often though? Like, I know
maybe every 3 months, every
4
months. Yeah, we do get at least 3 sessions a year for sure.
Okay. I think that's really important, because even the menstrual hygiene day happened for do something with UNFPA, and it's so funny. Even that, I remember I even tell me story for say, like, we see period, like, for even talk.
Right.
You see, I mean, they consider you nasty, for example, like these dirty common and so, so it was really good for the world. For making a period-friendly world.
This is normal.
You know what I mean? But these are all some of the things where now from where we grew up, like it was a lot. So even those boys were asking, questions and things like that. And I realized, we still not going inside Bokuti and the way we don't know.
No. Bokuti and the way we don't know, or if we know, we not open enough for able for freely communicate about it.
Right.
And again, one of the reasons why you talk about the TikTok videos, why I begin do is just because they think say, oh, this person, if you're not educated, now you're not go sabi, or this person, if you're not exposed, now you're not go sabi. No, there are educated, people that we will feel like say sabi things about their bodies, about their health. No, that is not common knowledge. So I'm like, hey, how about we share? So if a person don't need for come meet me, for ask me something, if I make the videos, it can go wherever. Somebody can now see and say, oh, I've learned something today.
Right.
But I think it's just the community where we will feel like we say, waiting we not talk about. Now happening ain't happen. No, that's false. That's false.
All right. So like vaginal health as well. Right. Like I say, woman them. We don't know. Menopause will be the last one because me, the person that's very interested in that. Because it's not about me. Me, fortunately, if I at least know a little bit. Like you just say, even if I don't know quickly, I don't want to Google.
Yes.
Everything where something happen, even if me period late for whatever reason, where I know say, okay, might not be pregnant, whatever it is, I don't Google what's that they do with science and so for me, at least I'm able to manage. But really, I'm doing this for everyone.
Right.
Sierra Leone. Because they don't even understand that as well.
Right.
But like I know with vaginal health as well, like so many things are happening with women in this system. So it's not some of the things that we go point out for somebody we probably not even know if it's not vaginal health.
When we talk about vaginal health, we talk about how for make sure say that part of your body they stay healthy. I have a lot of women coming in where they talk about, it will be period and I don't take my antibiotics, I flush things them out. I'm like, that's not for flush out. Or for say, like why I don't meet with man, I for take antibiotic again. Horribly wrong. So if you do anything in day, you predispose yourself to other infections.
Yeah.
So then one thing where they bother me, I say, okay, make that video day. That's one. But also hygiene. We know, within a place where within our topics, it's hot, it's humid, and then you go get person wearing nylon underwear. What's that thing called? Awareness, like the skin tight under.
That's awareness.
Yes, that's what they call awareness. Like skin tight under. Then you wear jean. It's like, oh my goodness, the amount of heat and humidity where you put here. So you predispose yourself to like fungal infections. So like and also making sure people they know waiting what we call post-coital hygiene, like after you don't meet with man, how you supposed to clean the area. That simple thing. Thank God within our place we say most people then they use water, but also using water means knowing that it's supposed to be front to back as you're cleaning. Making sure that even after you use the water, you're supposed to dry, because if you're not dry, you just humid conditions again at the area. So it's all of the intent and they making sure you're eating right, making sure you're exercising with the increased blood flow. All of the intent and they talk about vaginal health, safe sex, making sure you have either one partner or use a condom, because part of vaginal health now for ensure say you not get STIs, you not get sexually transmitted infections. So all of those things are important.
So like what you did talk about, and people then they wear like awareness, this and the other. Where would they go up now? That kind of time they were sitting, they protect themselves. Now that way them they look at, even where they wear uniform, they wear the skin tight on that, because I know but like you say clearly, say they do a lot of different things. Yeah. And more so when you mention antibiotics, we grew up in that era where we feel sin and day. Or like you say, mistakenly for whatever reason, if you sleep with man, of course it come inside you and everything else. for prevention. You go.
No, that is not a way how you prevent a pregnancy.
Right.
That is absolutely not a way how you prevent a pregnancy. So no, so it's all of them. You know, obviously within a stereotype myths and again people rely on with your other person experience be so that's what this me party say or me auntie say, whatever the case may be. But the whole aspect of vaginal health now for just no say one now, you know, the first person would know say something wrong in all parts of your body first of all. Exactly. So you're supposed to know yourself, and again part of that adolescent conversation then for make sure say young girls they know. I mean, we'll talk about vagina is not this entire area, it's just this canal.
Right.
The different parts then they don't yonder. But you know, you go talk to somebody, they go they talk about I see something in my vagina and it means something else. You know what I mean? Yes. So it's that anatomy part they making sure people that know as woman, I feel like for say basic know your parts where you get.
Exactly.
You know, and how for take care of them. So now they will mean what they talk about vagina health.
All right, cool. I think that's good as well. So where you they talk about even washing like that. Back to front to back. Front to back. Yes. Nice supposed to be.
Nice supposed
you understand? And more so because I read down in Google is more about, you know, bringing, you know,
I'm bringing whichever
like the anus for
the vagina and the you know and do that because you know we get normal bacteria in our body. They all they do different work na the side within day. You know, I mistake put one to the other side. So now I make that hygiene part that is so important. So obviously my mother will get girl picking. That's how they're supposed to be, you know, teaching them how for, you know, clean themselves and as we go on with life. Yeah, for sure.
All right, cool. I still have Dr. Wurie here with me. Don't go anywhere because I'll be right back after this commercial break.
Doro World Traveler, how is your Miami vacation going?
Fine, babe. I'll be back next week and I've bought you a lot of things.
Well, I hope the designer bag you promised is included. No excuse this time.
That expensive bag? Babe, I am now in Malaysia.
UBA cards work from Moscow to Malaysia, from Malaysia to Miami. Bros, you can't escape this time.
Help! Babe, are you there? I can't hear you again, oh. Your line is breaking. Hello? Hello? Wherever you travel in the world, don't go without your UBA card. UBA, Africa's global bank.
I am still here. Welcome back to Ellen Keister, the Word Talk Show. If you just walked in, I have Dr. Francis Wurie, the owner of the Women's Place Medical Center. We're all about them. If you miss, make sure you follow me YouTube and subscribe, and of course you can watch and catch you on live or on TV. Welcome back.
Thank
Dr.
you very much.
Before we go over to talk about vaginal health, and the other thing we them are even among Peking adolescents, you know, and everything else. It's about women and their smell. For example, you know, you get people I can see people online, they talk to like, oh man, you know, your vagina is supposed to, oh man, get smell basically. Of course, don't forget a bad one, but it's okay. Some people then can really, like you say, most of these antibiotics when you take, most of this douching, this, all this extra stuff is because they want to eliminate that smell. But I watch other videos as well where all the doctors, they probably say, like, you're okay. So what can you say about that?
The vagina not ever get for smell like flowers. It not ever gets for smell like roses. Naturally, it gets that sweat smell with musky smell. Waiting we don't want, now for let it smell like rank. That's nine we don't want in terms of smell. But waiting people then can they do again, as you say, with the douching, with the perfume and all the extra cream, you just predispose yourself to more infection because certain things and the way they gear and that smell they were supposed to get. Now they keep her healthy. Okay. That's how it's supposed to be. So for like you, what I can say at it, I have patients where they say I get me special towel for clean myself. I go take face towel, put on pass of water, put that inside. You are just causing more harm and not really make any sense. There's supposed to be a sweet, musky smell. That's how it is.
All right, cool. Well, another way for them and we not understand as well. We just feel say if it be roses.
No, roses not get for happen.
Like you say, and another thing is they said using just water.
Yes.
It's better than with soap.
Yes, and also again, remember I say what do we consider vagina na the canal. What you see outside, so now what's in we term vulva, the lips, society here, the if you not go bondo, the one way they inside, that one they now consider vulva. So that outside side, you can wash them with you water, but yes, you can use your mild scented soap where you wash with, not anything harsh. But what you know for do, now for go inside the canal. Then they naturally they clean itself. I can get woman where they come and say, "I did discharge." You're supposed to. Because it means to say the old cells then they come on, new cells then they come. What do we get problem with? Now if the discharge change color, if we change the smell, and then the quantity, now then we get problem. But you're supposed to go away with the old and get new ones, for sure.
All right, so it's okay, except if it smells like rank, then that's what the problem is.
Yes, that's
so not go for kill yourself or please that guy, make you understand, say,
not at all.
gets the musky
smell.
No to Versace perfume.
No, not at all.
Anyways,
Not at all.
and also, I mean, what you do as well is like wellness checks.
Yes.
I know, so you talk about even, of course, exercising and things like that. What would you say to women, of course, when it comes to that? Like,
well, unfortunately, within an environment, also we not get insurance. Lots of kind of way, because if you're there abroad, you get insurance. You know, say every year I suppose for go do me check. Also, as woman, depending on your age, then go do check your body, which is also something you're supposed to be doing every month after your period anyway. But at least that once a year check your body, do your blood work, check for cervical cancer. So every year then you do cervical cancer, but like when it's due, do cervical cancer check. Maybe do a scan, see how your uterus did do. You know, check your weight, maybe advise you on diet. All of those things now we'll talk about wellness check. But where it can to the fact that not so service way free. Obviously, you get for pay for them. Most people then they fall short. So you find out, say people that only they go to hospital when there's a problem, when they're sick. But the wellness check now basically things the way they do just cause I want check.
you want to check.
I want check if you cholesterol. You know, means to say pass you fat before you check cholesterol level, for example. You know, means to say pass you the drink rum before you check how you liver they work. So it's all of the thing and they that kind of comprehensive check where your doctor will talk about for make sure say right now for June 2024 you day in good optimal health and we need and the wellness check.
All right, so yeah, because like we say overseas, you know, they even send message to
of
you,
course,
remind you, you know what I mean?
Yeah.
You know, for do like your pap smear and all these different things. But yeah, so of course we not get standing, but you for even to come up upon yourself. Because another thing we learned over the years is when you talk about cervical cancer and so many other things. Before there was an age limit, like they say before we reach a certain age. But now we don't realize say people are even younger. We're not even meeting age and they.
Way campaign diseases. I mean. What do we recommend for cervical cancer? As long as you're sexually active or you don't reach the age of 21, you fully do cervical cancer checks. Usually we recommend every 3 to 5 years, depending on the method we do use. But yes, waiting woman them for no in general is first thing they say now we old, we 50, 60, now you get certain sick. That is not the case nowadays. I mean, even in the medical profession, we don't get young colleagues them, we don't die of breast cancer, ovarian cancer in their 30s. So like it's not even a thing where person they say pass at 50. Hence the reason why they say it's good that you know they're ahead of them things there. So you finally establish, you know, contact with a doctor that you trust. Because again when you come on medicine and you health, you finally you're able to go to somebody where you feel comfortable with, for talk to. Now that's saying that you did, but you also finally you sabi your body. Because as I said initially, if you know within at the normal your body, you're not anything right. You're the first person who's going to know this not be the last month, so I need to check it. This not be the last one to check it.
And some of these things, right? There are there signs and symptoms for it? Like we just talk, if you know your body, if you off a little bit, you will know. So but some that would just say, well, maybe now I go do something else, and then the doctor pick them up and things like that.
Right. So for example, lot of body breast, we they advocate that every woman they about for getting period, they will be the full, they farm, you're not going to feel that much. But with the period done, it is a bit flabby. Right. So what we can advise is that every month, either you're in the shower or you lay down, you're able to go around each body and check. You check just for feel like say, I feel some kind of lump, I feel some kind of pain, or you watch how the skin be there if it don't change at all, if anything of the sorts don't happen. So yes. Then you go prompt you say I need to go get checked as opposed to waiting. Not to all teen they present with pain, and most people go only because they have pain. So then I like wake up and breast, wake up at the cervix. Cervix is something we see. So you dey inside, you dey about your business, you dey move, and most of the changes where they happen to the cervix, it's almost as if God dey help we and give it time. Certain things then you catch them early, you get remedy. But if you wait until the last moment, there are limited options, especially in this part of the world. So not so all teen they get signs and symptoms. You understand what I mean?
Right. Well, I mean, I'm glad you make that clear as well, because like you say, there's this saying, you say, we were don't pass Gary.
Of course.
Or so all time you get for wait till the last minute.
Right.
Because I even know of a story about a young girl as well, we just a bit ignore on them Bobby, I think we get some lumped, but just feels just normal. Like I would something I boil or something, just ignore. Then I think they still change them. They change for some. I forgot the story. Then Paddy noticed like it's dark, it's black, like and
it was cancer.
It was cancer.
Yeah.
You know, and the whole time it's just like no say dated, but just ignoring it.
Yeah.
You know, so these are just all some of the things where we have to really, really, check our bodies. And also, I'm glad you mentioned the part for say, even it's not because you're drinking alcohol, your cholesterol and all that. Because that was a situation by somebody as well when they say no, they drink, no, they smoke, and she dropped dead.
Yes.
You know, and I'm like you said, I guess I'm in a way, but sometimes it's just all these little things because we just don't put a name to everything for say, because I drink, so I'm not going to check on me later. Because I know they smoke, I'm not going to check on me lungs. Because, but now with the world, the way things are happening, what I'm seeing, what I'm hearing, I don't realize, it doesn't even matter. Like a young lady we just lost, and it was like, was in a gym, they exercise, now they come on, they drinking or they smoke. Wow.
So hence the reason why the wellness checks are important.
Right.
That's the reason why I make it important that you know what's in the con with your body, ahead of time before you reach the point where you not get any solution. And now be frank, within our country we not get much of emergency services. So like one for say, you get heart attack and they won't go with your own side. You want to make sure everything what you're able to do for prevent certain things, you're doing it.
Do it. Okay.
Yeah.
All right, cool. Well, I don't want you to go anywhere because I'll be right back after this commercial break.
Hi, I am Leo, a super geek who's obsessed with artificial intelligence. I'm sure you're wondering how I got here.
Hi, Tony. It's been hard trying to find a quick way to send the cash across to you. The bank is quite far from where I stay. Girl, I'm trying to call that pop-up shop I saw on IG. I need them shoes for a party this weekend.
Wait a minute. I can solve all these problems. All I have to do is get back to my geek zone and get cracking. That's how I created this great virtual solution. Chat with me on Facebook Messenger and experience a whole new world of banking solutions without going to the bank. Make transfers, buy airtime, get account statements, and more. After all, going to the bank is boring. Like, I can't drink this delicious coffee and fill a teller at the same time. Get it?
We're almost at the end of the show. Welcome back to Ellen Keister, the World Talk Show. If you just walked in, I have Dr. Francis Ramatu Wurie, winner, the owner of Women's Place, Medical Center. We basically deal with women if you want for bond, if you want for check yourself, whatever it is, you can just go to them. During the show, of course, we don't talk about so many things that we save the land every day, to me fields. I mean, I able Google them, but I know most of them already watch, probably don't land a lot, but definitely we'll go back to, hours of operations and other things and other services that we offer, and then you go get for no more. Welcome back, Dr.
Thank you very much.
Welcome. Of course, we don't cover some different topics where I think it's very important for the world for now. I feel like we need to do a lot more. I wish you guys can all just come together and do big symposium for women across, or even continue for the do, like TikTok. I'm happy about that, but more so maybe take it to national TV where every week there's some form of training.
I used to on AYV. I used to host a show with the Women's Place before I even opened the clinic. So that was where I got the name from. So like where I come out studying in Uganda, be the host maybe every 2 weeks or so.
Okay.
Before Corona hit, and then after Corona, and go back for continue. Now I make be just really find like other ways for get the information out. But yeah, I used to host that show every Friday.
I know you're busy, but can you kind of go back to that? Because
we will see. We'll see.
Okay, so now the other thing we're very important in Sierra Leone or everywhere is the family planning. This contraception basically. Some people then feel say when you take the pills it's good. Some people then feel say when you do the implants. I forgot what they call us. Captain band. It's all the different things, and what you go say, are the best, contraception, or at the same time contraceptive, or at the same time, like, what would you advise somebody who's not ready for pregnancy yet, and we at some point don't realize, you know, it's in already now? How soon, if we're able to stop the contraceptive, whether now the pills or then anyone?
Yeah. So again, it cuts across age. Obviously, if adolescents, even though we teach you about sex, we preach abstinence for sure. Where you reach to a point, it depends on how long you are for it. I mean, like during antenatal clinic, and they would begin talk about contraception in the first place.
Okay.
While you're already pregnant, with a plan for, say, how you know we'll get belly back soon. How you do make sure, because mind you, contraception is about, it's a dual. It benefits the baby, it benefits the woman. The baby in that it get time for breastfeed well and get optimal growth, but the woman also for letting body get back to in pre-pregnancy state. You don't want a situation, I just born January, I get belly February. You don't want a situation like that because they work well for either the mom or the baby. So while the woman is already pregnant, we advise you about, well, we begin discuss as to how long you are going for wait till you get the next belly. Based on waiting you say, now go determine whose kind of contraception we go discuss. If you young girl, we sexually active, we come in, then the idea would be, okay, you're not ready yet to get pregnant. How long you are wait before you get belly? Again, that's going to determine the kind of contraception we'll go talk about. But sometimes it's just preference. Because if we talk about they talk about Captain Bag, which usually the annual they use, now we can put them in, they just under your skin. Usually the one we can use now Jadeli, they take about 5 years, but you can take them out at any point in time. Okay. But again, for some people, then go say then they sport. Some people they're not gonna get them period. Like these are common side effects, but it don't mean say every single person they get them. Some people didn't get any side effects whatsoever. But if you get side effects, there's always a remedy. But if it not work for you, we can take them out. Okay. If you can't do the coil where we put through the vagina into the uterus, then it can last for 10 years. Okay. But again, we can pull them at any point in time. Person will say maybe common side effects could be like if you go bleed buckle with your first period, some people will get cramping, something like that. That's okay. We get medication for, counteract then side effects in it. But again, if you're like, I'm not comfortable, I want to pull them. Simple, we go pull them. You also get pills, different types of pills. Pill the way we go give mama where they breastfeed, pill the way we go give the pussy when they breastfeed, and you get the emergency contraception pill. But I answer that question where you say how soon. Usually for all of the, and then you get the injection as well. Usually for all of these methods, the moment you left them, your body supposed to come back to the high day before you start them in the first place. So it's not like it add for make you infertile. Let's talk on that already. For sure, woman the way they take the injection, one of the common side effects that they're not going to get in period for a long time. And then yes, there is a remedy for that. So like I don't want people then feel like for say contraceptive methods they make like you infertile, they make you not able to get belly. That is not the case. But I want to lay special emphasis on emergency pills, as the word implies, emergency. Because I have a lot of women who can say, I know they see my period fine, or I don't miss my period. We do a pregnancy test and it's negative. Then, while you're discussing, you're like, oh, well, I take the emergency contraceptive. This medication are for only if you are having sex like once a month, once every 2 months. You go make mistakes on side, that kind of thing.
So you cannot be taking it like.
So if you're in a relationship where you are having regular sex, it is not for you. You can't then also with your man and they get sex 2-3 times a week and then they take emergency contraceptive 2-3 times a week because it's not high dose hormones. So you don't want to put that in your body constantly. So now just for the intent and the way you don't mistake. And then you can say, okay, let's come, but not also the person go use regularly. All the others you can use regularly, but not that one. Yeah.
The word emergency.
Emergency.
For bypass mistakenly, you understand?
Yes.
All right, so now we're going to talk about menopause. like I said, I saw that video, and then I realized, I'm like, you know, a lot of people don't really know what it is. At the same time, the confusion is the fact that, of course, menopause, and we suffer C period, that means you know the born again.
Right.
But then with the year, stories them of people that weigh 50 something. Like, right, I think last night I was just playing on TikTok, I saw somebody who was 50 something and having a baby. But then at the same time, you get people that weigh 40 and though it's menopause.
Right.
You know what I mean?
So menopause, they happen, as you rightly say, where you don't stop your period. And if you don't stop your period, the idea is, you know, they ovulate, meaning egg need to come out again. And the thing that we will get inside our belly, where we call ovaries, where they produce their egg, then they produce certain chemical, then they don't reduce, we don't reach menopause. But all man age of menopause different. Same way how all man they starting period different. Some people they're 9, 10, they don't start in period. Some people they're past 16, 17, they start in period. So we get a specific lifespan, reproductive lifespan for everybody. So yes, maybe that person is still old 54, they see in period. Maybe old 17, 18 before he starts in period. You know what I mean? So like it's different for everybody. So when they say, oh, as you reach 50, so period on done. It's not like that. So for sure. But menopause na a normal stage na a woman in life. And why I thought it fit for do that video there was because I would get again a lot of, you know, middle-aged older women coming in a state of confusion. It's like, what did happen to me? Are they sweat? Are they confused? Are they forget? Are they all in kind of like, what did happen to me? And because again, we're not in a place who say, Mama, they able to do it in Peking and talk that kind of way there, and you know, like those things are passed down. People sometimes find themselves in a state of confusion, like, I feel like I decrease. Now I make a do that. But yes, it's a normal part of people in life. And why it's important for we talk about now, because we not just want the woman where they go through for understand. We want the people that are around them. Because you're in a house with maybe your partner, you're picking them. All the go say this, mommy. All the forget. All the this, and also you can be if you start menopause at 40 or 57, you're still sexually active. But then menopause, they come with a whole lot of vaginal dryness. It impacts your sexual life. It impacts your human, maybe something they with relations. You know what I mean? So now I make it fine, like the whole family understand what it is, so that they give for guide this woman through and also let themselves can breathe. So they don't say this is just a vex for nothing. They would already understand what you need to go through.
Right. It's so funny you brought that up. I think it happened to me in a way, right? I was so confused, and then it's like when you period, it don't come all throughout. Then maybe 1 month it kind of just bounces out, or just you spot instead of you see the full period, and paranoia One of the doctor like, eventually go for all this, it's like, no, you still okay, this and that. Let me watch this month, He asked me, you pee on the car regularly? I'm like, yes. He's like, oh, it happens. Are you stressed? I'm like, maybe. And everything else. But of course, because I'm over 40, so the first thing that came to my mind was like, oh my God. They said this to happen, and then we did all the checks, and it was okay. But then I just realized, imagine me knowing a little bit, it's going through this.
You're still confused.
Right, I'm still confused. What about that woman within a corner where probably not even get an idea of what's in the going with like you say, it's not about you, the individuals, but the people around. Like you go see somebody there in a gathering, very, very hot.
Yes.
You put it like, now you want to get sweat past all man, I can, me with him, so I'm like, if you know it's not man, they go through. So that should the point where I think we all can just make joke about it if we're in in a place where everybody's sweating everything, we just say, menopause. Before you even think ourselves, we don't even provoke ourselves and everything.
And that's exactly you're making light of a situation. That's good because first there's like shame,
right? Oh yeah.
But like if people then date together and now they openly discuss and it's like, but this is a normal part of life. What's
exactly?
Yeah.
Yeah, but what would you say? I mean, I know what are some of the maybe the warnings or signs and symptoms before you actually get there? Because I know it doesn't just stop.
All right. So as you mentioned, it will happen. Say this woman has to go be a skip periods, or the flow, the amount of blood where they come out, they begin for less. That is something a person they watch. Tiredness, lethargy, forgetfulness, the sweats where we don't talk about. On my comfortable nights, the tantrums, the vaginal dryness, all of them in then reason why make person go say something they happen here so until they even bone pains like you know they get joint pains where you reach and then you go to the hospital, then you make sure say then do blood check for you. These are two ways. We can do a scan, see how your ovaries and we can do blood work, see how your hormone levels are. Then you came for say fine, you didn't at the point now where you there around menopause or you don't reach menopause. Actually, for we say you don't reach menopause, you don't skip your period for a whole year. So you don't get consecutive.
So not just a month or two.
Right. So we will say that in a perimenopausal, meaning around. So you know exactly. You did around. But like for we say you don't reach menopause, if you don't skip the period for a whole year, then it's like okay, you're done.
You're done. All right. Cool. Well, we don't learn a lot today. But let me go back briefly to the woman's place. Like you say, I mean, it's not the same as the government because you try to give them care. So you're not going to even disclose the price. However, I mean, you for able to go there because you want to make you comfortable, give you everything. So outside the woman's place then?
So we used for being Wilkinson Road, but we just moved now to Moritong across from grammar school. We've been there for about 4 months now. So now they're at the current location.
Okay, is it open every day? What are your hours
24
of operation?
hours.
24 hours?
24 hours. As well as there's always somebody there. So it's round the clock service.
Okay.
Yeah.
So this is not just light, it gives me curiosity.
Yeah.
How many babies have you delivered?
If I take just the woman's place, I'm sure we're close to 500 now. Whoa. If I take just the woman's place, if I take since I graduated medical school in 2009, so like I don't know, maybe thousands.
Really?
It's so weird when sometimes you work on a state and person say doctor, this is not a Pekin, and then you're like the Pekin where you deliver, and you're looking like at that old, but anyway, it's been good. I mean, I think say you always when you choose a field of because it's a field of service, whatever it is, it's service. You're providing a service, and you're always hopeful that people then take up and be trust in you and believe in you. So the gratitude for the amount of patients then where they come, where they entrust me with their health care, it's immense. I mean, I think that also talks true to the kind of work that we do. Cool. For maybe like for say it's mostly word of mouth. You person come and you ask and say, but yeah, me paddy this, me that. So it's not even about that. So it's always good. But yeah, it's been it's a lot of work.
So Dr. Wurie, the OBGYN, you mentioned about your child. How are you able children? How are you able to balance work, and family?
Support. I mean, I don't even take this lightly. I think say, that proverbial saying of it takes a village, it does take a village. Because for I able for grab and do the work I do, it means that I have support with family. So definitely I'm grateful for that. And my kids, they try to be understanding. I mean, I think so they understand the work I do. Sometimes we go out, say, since they were sitting in a restaurant and simultaneously two people come, Dr. Hello, Dr. And they're like, how do they know you? Like, well, they know me. That kind of feeling. So they understand the work I do and know that it's service. So yeah, I think it's just support. This is not something you can do alone. So I know they take on lightly the fact that there's somebody at home for make sure say the days that I can't be there, my kids are taken care of. Yes, for sure.
But in the process, you make time for you.
Oh, I try. Now I try. Not only one day walk na the woman's place. Obviously, there are other doctors. So I'm so grateful for the fact that I have other people. So on those days when it's their day, I'm not around. So I make sure say yes, I take my time and do what I have to do, and so yes, I definitely make the time now. For sure.
Cool. Thank you so much. Of course, we don't come to the end of the show. I appreciate you coming here, and basically telling us things that we don't know. Yes. So thank you.
No problem.
Have a really nice gift for you. Just to say thank you.
Thank you so much. much. Lovely.
All right. So, I mean, all the best. And of course, you mentioned the adolescent symposium where you did
Of course. We always
once every 3 months.
advertise on the hospital's number. There's usually, and we're on Facebook, we're on TikTok. I have somebody who coordinates all the social media things. So yeah, so definitely whenever we do something like that, it will be publicized.
It will be publicized.
Yeah.
You will get for CM, and of course, I'm pretty sure I will share as well. So this is the end of the show for today. Of course, I don't want to go, but I've got to go. I've been your host today, Ellen Keister. Till next week.